And so independent living in the senior living world is simply that. It's designed to really be a way to maximize your lifestyle. So where you can come in, you can live in a community where you don't have to worry about the cutting the lawn, the landscaping outside, the maintenance. The hot water heater goes down. Now you got to call somebody. You got to take care of that. There's a variety of independent living communities out there. Some are going to provide all of your food for you. They're going to cook. They're going to clean. They're going to do all these things for you. Some of them, there's a little combination where maybe they're going to do a little cooking and you're going to do some cooking as well. So it really is about a lifestyle, just maximizing a freedom lifestyle, I think.
And is there a lease required or an upfront move-in cost?
Yep, so once again, it's different at every community. There's some communities that have a buy-in that you it might be a larger sum, but it's more of a long-term thing, and there might be a little more perks or whatever going on with it. Our community, Royal Palm, which is pretty standard in the business as well, we require what's called a community fee, and that's just a one-time, it's not an annual, just a one-time fee up front. Ours is $1,500 that you pay. It's just one time, just helps get the apartment ready, everything good to go. And then after that, it's a month-to-month lease. So at Royal Palm, it's changed recently in the independent living world where it used to be, and I don't know how other communities operate, where the first initial term of the lease used to be 6 months and a day, and then after that it was month-to-month. And now I know we've kind of just changed a little bit of the way we do things, and so it's strictly a month-to-month lease.
And what happens when someone lives in your independent living community and they need some assistance?
So one of the great things about independent living is, independent living in a community such as ours or such as others around, is that you are surrounded by a lot of your peers, a lot of your friends, and you just have a lot more resources available to you. Royal Palm, we have an independent living and we also have assisted living within our community. And so we have nurses that work in our building. We also have home health agencies in our building. We bring in doctors. We try to bring in as many, I don't want to say generic, but the podiatrist and the hearing and a primary care doctor. We try to bring as many things into the building as we possibly can, just to make it more convenient and to provide those resources for our residents. So if you're an independent living, obviously that's independent. You don't require any extra health care, any help from us as Royal Palm, that type of thing. But we have resources in the community. Say, you're independent and you just need a little help with getting your meds sorted out on a monthly basis or a weekly basis or whatever. That's where home health comes in to play. Private duty home care is a great resource. Maybe you just need a little help, just making sure that your apartment gets cleaned up a couple times a week, or just really maybe someone just helping standby assist for a shower or something like that. You don't really need the full service or all the stuff to have to move over into assisted living. You just need a little bit of help right now, and that's where the home health world and private duty home care can be a tremendous asset. Really, it's all geared to help you live as independently as possible for as long as possible.
And you mentioned a lot of services that would trigger you to move into the next phase of assisted living, which we are going to go over. But tell us, when you're in an independent living community, what services are included?
So at Royal Palm, the services included, there's 3 meals a day and snacks. We have a very active community, and so there's different activities going on throughout the day, whether that's live entertainment or games, card games, puzzles, movies, just different things like that. We have housekeeping that comes in on a regular basis that's there. We have a full maintenance team that's there to take care of any nicks or anything that's going on. If something's not working in your apartment, the hot water, whatever it is, you call us and we get on that. And we have parking, covered parking, that type of thing as well. So those are some of the services that we would offer.
and you touched on parking, so transportation, is that included as well?
Yeah, so I mean, independent living, many of you still drive, and and that can be a scary thing anyways when you drive around here in the streets of Port Charlotte. It can be a little hectic, right? But so we have parking, we have many residents that drive and go do their thing, and even the same residents who have their own vehicles are also able to take part of, you know, we have a bus that we utilize to go to doctor's appointments, to go to the bank, to go to Walmart, to go to stores, and so our independent living residents are able to take advantage of that as well if they don't want to, you know, brave the pavement out there.
Can I sign up for that? All right, we want to hear from you. Do you have any questions in the audience? Now you're all full. Earlier you were all hungry and you weren't talking. Now you're full. Yes, ma'am.
You mentioned that you have assisted living, so can you help them transition?
So her question is, you mentioned you have assisted living at your particular community. Will you help them transition into the assisted if they need help?
Yes, yeah, we do, and that can oftentimes, I mean, for the most part, that's a slow progression. We all kind of, you know, maybe someone starts getting some home health services, and then they add a few more services, and it's usually a conversation that we're having with you, your family, and over time we might be saying it's looking like, you know, it could really benefit, instead of getting all these home health services, instead of having private duty come in and doing all these things, to really move over to the assisted living side and take part of
There was one question about it. Do you charge a moving fee if you help do the transition?
From IL to AL? We don't, no.
There are some communities that do. We're gonna go, we have a whole panel on assisted living coming up too, so.
So just real quickly, assisted is licensed by the state. To be an assisted living community, you gotta be licensed. It's regulated by AHCA, the Agency of Healthcare Administration. There's a lot of rules, there's a lot of things that, because the assisted living side is considered a healthcare facility, a healthcare community. Whereas independent living is, I mean, the only license to have an independent living community is basically room and board licensing, and you know, you gotta have the health department and all that type of stuff. So there's much more. Independent living is basically just an apartment complex, that's all it really is. But we add some convenience services, housekeeping, maintenance, cooking, and all that type of thing.
Yes, ma'am. You did mention 3 meals a day with independent living.
Yes.
Is that optional?
She asked if the 3 meals a day in our community was optional in the independent living. It's the way our services are set up. It's just all part of. It's like an all-inclusive rate, and so there's nothing that gets broken out of that.
So you don't get a credit if you don't, but you should try their food before you knock it. It's really good.
If you have a question, raise your hand, please.
But if it's obvious, if it's independent, it's gonna cost more than the assistant.
Other way around.
It's the other way around, because you're not receiving any healthcare services from us, and so it's really you're living independently. You're just living in our apartment complex, and included into your rent is all your utilities. The only thing that's not included in your rent is a phone. And so if you have a cell phone, you're good to go. You're already. Otherwise, you would call Comcast or Xfinity, you know, or whoever the other companies are.
What is the difference in the price?
So for us, our independent living prices start at about $1,800 a month. And that's an all-inclusive rate. And then when you move over to the assisted living, for a private room, you're talking more like $2,600 to $2,700 starting rate.
And you can talk to them individually when they're all done, so no worries.
And we have another person coming up to
Yeah.
talk about assisted.
But different facilities are different.
Yep.
And you, communities, sorry, I don't use the word. It's community. But we have people who can talk to you about that because each location's different, and we have somebody coming up next for assisted living.
For the price, where you're located,
What's that?
the room is different where you're located on the
Within the community, I mean, there's different types of rooms, yes. So there could be a studio, a one-bedroom, so obviously.
It sounds like you need to tour that community. That beautiful lady behind you, Tanya, can definitely take you around. Any more questions? Because we have about a minute left with this presenter.
All right, you got what Deb wanted? Do you offer any respite care?
In the independent living,
Period.
we do provide respite care, yes. And our respite care is a minimum of 1 week, 7 days.
In their assisted living.
Yeah, usually, yeah. So for us, we can do respite care. And if you're curious about independent living, one of the things that we would love to invite you to is to come and stay with us for 2 or 3 days on us. We have a guest suite all set up where you could come, you could experience the activities, experience the food, and just kind of get a little glimpse of what it might be, if it's something for you, if it's something you'd be interested in. Maybe in a couple of years you want to maybe downsize a little bit, and you just want to get a feel for maybe what that would be like. We'd love to meet you, we'd love to talk to you, and have you come and join us for a couple of days and just see
I
what
like
it's like.
that. Try it before you buy it program.
There you go,
People.
there you go.
It's the way to go. Okay, we have one more question in the back, and then we're going to have to wrap up.
How many assisted living rooms do you have at your facility?
We're licensed for assisted living, we're licensed for 125.
Another great place to find all of this information is in your seniors blue book.
That's right.
We are located on Harbor Avenue, basically right down the road, right behind Winn-Dixie and the sheriff's office there.
Okay, let's give Chad a round of applause. Thank you for your participation.
All right. How we doing, guys? We're back. So what we did for the sake of time, because there's so much information. I know we're like giving you guys a lot of stuff today, but for the sake of time, what we're going to do is we're going to combine this assisted living portion of our segment. And so real quick, I just wanted to give before. So Sam's going to ask for. First of all, let me introduce Samantha Reyes. She's our administrator at our assisted living facility. So for those that don't know, Chelsea and I actually, my wife and I, we had just gotten married. We lived in our assisted living facility for 3.5 years. That was how we got started in this industry before we, started doing the daycare and the home care, and then being able to share information with you guys like this. So we've lived in the environment that you guys are probably very familiar with. What it's like to care for someone for 24/7, living with that person. So been there, done that. I can relate in some ways to what you guys are going through and the difficulties you guys might be facing. So that being said, though, Samantha is our administrator at our assisted living facility. Noelle is she's the director of sales and marketing, of sales at Lexington Manor, and they're another assisted living facility in town that we partner with a lot too. Just another highly trusted counterpart to the assisted living world. So very grateful to have her on. Thank you. So thank you, Noelle. And so real quick, what I wanted to share is one of the things we want to talk about too is adult family care homes. So some of you guys may not be aware of those, but I'm going to give you just a brief rundown of what they are. And so typically a residential setting, you're going to have 5 beds or less. It's going to be licensed by the state of Florida, and it's only licensed for 5 people or less. It's going to be like a 3-bedroom, 2-bath home that someone has decided to convert into an adult family care home. It's a little bit less restrictive license than assisted living. There's a little bit less oversight by ACA, the governing board, but the thing is it's going to be a little less expensive for folks. So if cost is a factor when it comes to care, an adult family care home may be an option. Typically one of the requirements is that the person that owns the home is going to be living there as well. So they might be an owner operator that lives there in the adult family care home. So it's going to might be a husband and wife couple. They might have like one caregiver, and they might, that might be what their responsibility or their primary job is. And there's, I think, 335. Let's see here. I got the stats somewhere. I just wanted to share with you guys. In the state of Florida, there's 335 total that are in the state of Florida that are licensed. So just so you know that you might be going through your neighborhood and you might not realize that there might be a house right next door that could be an adult family care home. So that being said, we'll roll into the assisted living portion of it. And so just so you know, so Samantha and I, we would consider ourselves more of a residential assisted living. We're licensed for 14 residents, whereas Noelle, she's a little bit larger, more of an institutional type assisted living. Where I guess what's your capacity there?
We're licensed for 110 residents, and we have 85 units altogether.
Gotcha. So just two different types of facilities, but at the end of the day, we actually have the same standard license assisted living. So the ACA, the state of Florida, will actually govern us identical to one another. So they don't look at us as any different when they come in, as far as making sure that we have certain things taken care of, making sure that the rules and regulations are being followed a certain way. They're looking at both of us as the same. We have to follow through on the same thing just as much as they do. So that being said, I'm gonna let Sam ask the questions, and we'll see what happens.
All right, so when is the right time to move into assisted living?
Go for it.
So I think the right time to look into assisted living isn't when, something happens. It's always good to be proactive and see what's out there. There is a lot to see out in Charlotte County, as I'm sure that you guys have been hearing. I always think it's really great to do your homework and get out there and just look at communities, even if you really want to stay at home for as long as you can. Sometimes the need arises, and then we find a lot of people are scrambling to try to look for a place, and they physically can't get out and look at a place, so they have families, family members, friends, neighbors actually going out and doing the looking for them. So I think that while you're able to get out there and just do a little bit of homework. I mean, we have people come to us all the time. We have people that are on our waiting list for years, and they're just doing their homework and getting educated. And it's not, they may never even come to us, but at least they have some knowledge about it if they need it. And I think that people have longevity with us in assisted living. You're taken care of, you're eating well, you're active, you have socialization. So people live a really great life with us in assisted living. So
and two, just like we were talking about earlier, the morning session was about staying at home. If we stay at home, what are our options, right? And we talked about how socialization is an important component of that. But if we're deciding to move into assisted living, again, here we are now, kind of going through that same socialization thing, just as important, but now maybe not in our home anymore. Now we're moving out, but we want to make sure that that's still a component of of what we're doing on a daily basis. Maybe now we're just not responsible for our laundry anymore, or that housekeeping, and there's a lot of those things. I'm like, dang, this would be so much easier if we just moved back into our ALF, because we literally had the girls would put dinner out for us and set it aside, and it was easy, How do you want us to do your laundry? It was nice and easy, but the reality of it is if we can eliminate some of those other things, and now I can focus a lot of my time on just enjoying life, going out on outings, participating with my friends, my new friends that I maybe have met there, or even the friends in the community I might still have, but I know I can go back home to a supportive environment where I'm going to be safe, and there's people there if I need anything I can reach out to, so.
So what kinds of services are provided in assisted living?
So I know for the sake of time, maybe I know you guys may know a lot of them, but why don't you go through a quick rundown of what we do in assisted living?
So it's an all-inclusive. So you have your basic monthly rate, and your laundry, your housekeeping, your cable, all your utilities, your 3 meals a day. All of that is included in that basic price. If you need anything additional, you know, care-wise, if you need help with, you know, any of your daily routine, you know, maybe just to stand by, assist with bathing, getting dressed, you know, those kind of things, that a lot of places, I know how we do it at Lexington, we have care levels. And it works out really well for us. Medication management, we also have, you know, levels for that as well. If that's just really what you need, is just, you know, your medications are becoming overwhelming to you. And I know different places do it differently. Some people do like a la carte services. So it just depends on the community.
And to Noelle's point is that, yeah, every community is going to be different in that way. But typically, what you might find is you kind of you'll find maybe an all-inclusive rate, or you'll find maybe a base rate with some additional add-ons for care. I know, like in our case, we have like 3 different rates. One's if they're all inclusive at each one of those rates. It just depends on where we're at from a care standpoint. Typically, that's where that additional care would be needed. I know we have like a what we call a princess package that Amy calls it that. But like essentially that might be that addition. If the family needs like maybe 12 hours a day of additional one-on-one care with someone, or they need all this extra stuff, then like that person, we could build a custom care plan around what their needs are, and then that would be a totally separate thing than maybe just if someone that's fairly independent just needs a little help with maybe medication management, meals, light housekeeping, laundry, things like that. That might be a separate rate. But once you in the state of Florida too, the average, for you guys that are curious, the average cost of assisted living in Florida is $3,500 a month. But that means that you might find some facilities that might charge $2,000 for a semi-private room maybe, or you might find some facilities that might be as high as $5,500, $6,500 for maybe memory care type services. Or you might, if you go down to Naples, I know they just built this beautiful like Taj Mahal that's like $6,500 a month, starting out for those. So it just depends on what you're looking for. Every facility really is gonna be a little bit different, but that's why when Noelle said, go do your homework ahead of time, now you can go and say, okay, this is how this one works, this is how this one works, each one of them are a little bit different. Here's my cost. If I need more care down the road, how much more will it cost me? Can my loved one stay here forever? What are my options if I need to make a change down the road too? So.
Now, does insurance pay for assisted living?
We get that question asked all the time, don't we?
We do. So I know we're a private pay community. There, if you have a long-term care policy that you paid on, depending on what your criteria is on that policy, everyone's different. We've seen a lot of different ones. That may help with the cost of assisted living. And I know that, you may have to meet some criteria as well for them to, start on that policy. And then I'm sure you guys had talked about veteran benefits earlier today. Right. So there is aid and attendance available, and I would say probably more than half of my residents at Lexington Manor, whether it's the veterans or the surviving spouses, are receiving some aid and attendance, which is absolutely wonderful. It's one of the first things that I ask on a tour.
And if like this morning we were talking about staying at home, and so we had mentioned aid and attendance. We'd also mentioned long-term care. The only difference might be is that your long-term care policy might pay more in assisted living, or it might just have a different rate. So depending on whether you're trying to use home care, adult daycare, you're trying to like maybe help keep you and your loved one at home. There's going to be maybe a different rate component that they would pay on your behalf as opposed to assisted living. And then same with the aid and attendance. There's going to be that homebound rate is different than what they may pay for in an assisted living facility. So again, just there might be similarities, but just going back to, okay, well now when I'm considering that, don't just assume that long-term care is going to pay the same. Kind of look into, well, what's my long-term care benefit for an ALF or an assisted living facility?
Yeah. A lot of people have to dig out their policies. They haven't looked at it in a long time, and then give a phone call to that provider.
And the paper's always yellow too.
Yes.
Now, how do you get started or begin the process if you've picked a community that you would love your loved one to move in? Can you explain to them what that process would be?
So probably I was thinking like maybe on the 1823 side.
Yes.
If you want.
So there is a form that your primary physician is going to complete for us for any assisted living in the state of Florida. It is called an 1823 form, and you don't have to remember that because we, of course, will assist with getting that for you. But that tells us a lot about you. It tells us about your medical history. It's going to tell us what you're independent with, what you might need assistance with. It's going to have a med list. So it's very important for us to have that, and you know, it's a very important component of move-in in assisted living. And I'm sure that, you know, like Lexington Manor, we do an initial assessment with our director of nursing. So we have a care tool that we use that is actually wonderful. We base our care off of a point system. So we go over that with the family and the resident, and so that everybody is on the same page of exactly what we're going to be providing as far as care. So that's really a big part of it. And then also, of course, there's lots of paperwork. There's, you know, lease signing and resident handbooks and all sorts of stuff that we actually sit down and do with you and go through, and so that's
and I think you're finding most of, you know, that initial assessment is so important, because, you know, you guys are, you know, you're checking us out. You know, you're looking into assisted living as well. It's like, okay, you know, what's the best place for me? And then we're also trying to make sure, you know, is your loved one the right fit for our community as well? Because we want to make sure it's a, you know, if we were to just say take every person that, you know, came by for a tour, it wouldn't be fair to you guys, because we want to make sure that our other residents, you know, are in an environment that's going to be conducive to the type of care that they need, and that your loved one is in an environment that's going to be, you know, it's going to help that person thrive. You know, so if someone is maybe has late stages of Alzheimer's or dementia, and maybe they're not able to socialize or to be a part of the dinner discussion or something like that, you know, it might be hard to have that person with someone who's highly cognizant. You know, so we're going to talk later in just a few minutes with Melissa, and she can talk more about the memory care side of things too. So making sure that, like, you know, is this person appropriate, and for us to be able to come to your home or to meet with you, or you to bring your loved one in for a lunch tour or something like that, and we can get a general idea of where they're at, and then we can make an assessment and say, you know, we actually might feel like this person might benefit from this community more, or this might be a better option for them over here, or we're the right fit. It just depends on, you know, everyone's needs and stuff like that.
I would say that face-to-face is so important, just because we do want to make sure that we can meet your needs in our community, because we would never want somebody to come to us and say, oh yeah, you know, you can move in, and then a week later we're calling you saying, no, this really isn't working out. Exactly. So it's very important. And I always tell people, like, you know, like with the daycare and home care, it's like dating, and getting, you know, moving into an assisted living facility is like getting married. You know, you want to make sure you're making a commitment. You're making that commitment to the family. I want to know that I can commit to you and your loved one, and I don't have to, like, break my commitment with you guys, you know. So it's important for us to do that initial homework so we can make that commitment. And when we're going in there, we've done the best we can at that point in time, you know, to be able to commit to you and your loved one. So.
Does anybody have any questions?
For the tours, are they available on the weekends for those of us who work?
We are, always. We always have a manager on duty. And if you call us, you know, I will personally give you a call back within an hour. But yes, we do weekend tours. That's important.
They have assisted living. Is it a assisted living homes? Is it assisted living, assisted place, assisted living? Is that a you know, assisted living home?
There's different types of facilities. No, we're gonna be talking about that in here in a little bit.
And typically, like that's an impression that some people have if they haven't ever had to deal with this before. You guys might be a little more familiar with what assisted living is, but I know a lot of times, like, before I ever came into the industry, I always thought assisted living and nursing home were one and the same. And so you know, my impression of what a nursing home is, I just thought that was all the same stuff. But I realized it's not, and they're very different. So the nursing home, or a skilled nursing facility in today's world, is going to be a higher level skilled type care, as opposed to assisted living, where, you know, really folks are more independent. We're just trying to help assist them with, you know, to maintain their independence as long as possible. So. So no, it would be it is like a residential building. You know, folks do live there long term. So it becomes their new home.
It's like an apartment.
It's like an apartment. Yep, exactly.
And I would say more, assisted living is more home-like versus clinical.
Right, exactly. Yep, yep. So even though like Noel's facility might be bigger, it's still like a home-like feeling. It is an apartment type like feeling. It's just you know, whereas yeah, like you said, skilled nursing is definitely going to be more of a clinical setting. You know, way more medical nursing stations, things like that. So I know it's a lot of stuff, guys, but. But we're gonna cover memory care, which is gonna be another form of assisted living, and just you know, a different, you know, they're gonna be catering to the needs of a specific, you know, the memory care folks that need a little bit higher level of care. So we're gonna bring Melissa up next, and then we're gonna roll into CCI. Noel, thank you so much.
Thank you, everybody, and stop by and see us sometime. We're on Veterans Boulevard.
And if you have any questions, make sure you reach out to Noel. She'll be in the back for a little bit too, I'm sure, and then her information's in the bags. So me and Melissa tried to do this the other day. So
Chris had some stomach issues,
I don't know
so
what was
that
going
didn't
on,
work
man.
out very well.
So literally we were about to do this educational video, sitting in the same chair, similar situation over there, and all of a sudden I'm like, and, you know, I'm like running around like crazy because I had this abdominal like cramp pain. I'm like, what's going on, you know? And then you know, I felt a little like faint, but I'm like, I'm gonna muscle through this thing. And then she looks at me, she's like, are you sure you want to do this? I'm like, no, I'm done. I'm like, I'm good. So anyways, here we go, round two. Let's see if we can do this today. But so Melissa she is such an expert when it comes to memory care. All the certifications and qualifications that she has in the Alzheimer's dementia world, it's really incredible. So I'm gonna really just let her just take the ball on this one. And Melissa, tell us a little bit about what memory care is. How is it different than maybe like a standard assisted living, and just kind of dive into all that stuff for us.
Okay. Great question. So anytime that you are talking memory care, you are talking about it's still an apartment like an assisted living setting. However, it offers you that more higher level of care. So with residents at the Springs at South Biscayne, we are what is called a secure memory care community. That does mean that if a resident is exit seeking or wandering, they're in a very safe environment. Yes, they can still go outside and things like that, because that is important when you're talking about any kind of cognitive impairment, is to still be able to utilize all the things that they are used to doing. Being outside, being active, being musically engaged, all of that is very important. However, we want to make sure that when you're talking memory care, that you are talking about, number one, the right ratios for residents and staffing, because memory care, you typically need that more individualized care versus assisted living. They need someone there who is going to really not just help them get dressed, help them go to the toilet, but someone who is going to bring them out into the world that they thrive in, whatever world that may be. So memory care, and this is my passion, I mean, anytime we talk about Alzheimer's or anything to do with dementia, this is my passion. So when you are looking for a place to put someone, and I do believe home is always the best environment, but there are times where that isn't an option. And when it comes to the time when that is not an option, one of the very first things you want to look at is it going to be a community that is going to engage my loved one, who is going to offer them things that they like to do. And I'm not talking about things that are maybe above their acuity level, because if we're playing cards and your loved one cannot play cards, then we're not really enhancing their quality of life, are we? No, we're just putting an activity on the calendar, put an activity on a calendar. So one of the things that I do, and I love doing this for anybody out there who's caring for someone who has cognitive impairment, I do what's called a virtual dementia tour. And for 8 minutes, I take a normal, healthy brain and I alter your brain to having advanced Alzheimer's. And this gives you an idea window of what their world is really like. And I promise you one thing, when you walk through and you're done with that virtual dementia experience, you will never look at your loved one the same way. Because you have walked in their shoes and you understand now how difficult their world really is. So another thing that is important when you're looking for memory care is what kind of training do the people who are caring for my loved one every day, what kind of training do they have? Is it just the regular training to be in an assisted living? Some places might be. With me and the Springs, I make sure that my staff not only goes through the state regulated training, they go through the Alzheimer's training because I am your Alzheimer's ambassador, but then they also go through every 4 months, they go through the virtual dementia experience. Not only the walkthrough, but the eating process as well, because we tend to forget when we have loved ones who have problems with eating, we tend to forget why they're doing that. Anytime you have cognitive impairment, one of the very first things that you will notice is the sensitivity in the top of the skull. So you may find that your loved one doesn't like showers anymore. And the reason for that is because the nerve endings in our scalp become super, super sensitive. So when that water hits the scalp from the top, it is a fear factor for them. However, if you simply lean the head back and let the water run from the here to the back, you will see a total change. These are some of the things that my staff is trained on. These are some of the things I bring out to the community because I believe knowledge is power. And I believe that if we are all trained in the world of dementia, because guys, caregivers' mortality rate is 4 times higher than those that you're caring for. And a lady asked a question earlier today about how do I let emergency responders know that I have a caregiver and the red dot issue. Make sure it's also on your refrigerator, because then they call in professionals. Before I came here this morning, we had a 911 call, and it was a lady who was being transported to Bayfront Hospital, but she had a husband she was caregiving for, and no one knew how to interact with him. He was trying to actually tackle the sheriff's officers that were in there. So they called me in to kind of divert him so they could get her out to seek the medical that she needed, the medical treatment. So I could talk all day about Alzheimer's. And
See, she is the expert, you know? She's so one of the questions I think it's important too for folks is when you think about that transition from maybe the standard type of assisted living to the memory care side, what is maybe some things that you look for to say like this person maybe needs more of a memory care facility as opposed to just standard assisted living?
Good question, Chris. So one of the things that we look for is, can they navigate their daily routine? If they were in an assisted living community, can they find their way to activities? Can they find their way to the dining room? And even at home, I mean, same thing at home. Can they really live in that world without that extra assistance? So memory care isn't just for someone who is really advanced Alzheimer's. It's really for someone who needs that additional care, staffing, attention. And that's my biggest message. It's not just for those who are exit seeking. When you're talking any kind of cognitive impairment, a lot of places don't want to necessarily accept someone with Lewy body because of the Lewy body tends to be a very violent form of dementia. We do not discriminate about any forms of dementia. We, at the Springs, we open all forms of dementia into our community.
Do you guys have any questions for Melissa? Because I know we walked through a lot of types of senior housing, independent living, assisted living, smaller, larger, memory care. And the thing is a lot of these facilities you're going to find they might have a combination of some of these services. So you might have independent paired with assisted, you might have memory care paired with assisted, you might have just a variety of different types of senior housing out there. So just everyone's a little bit different. And it's important to just go and seek that out. But yeah, go ahead.
If somebody you know has got this start of dementia? Is it better to get them into assisted living so they're used to a community that then progresses into memory care, or let them be at home in their routine as long as they can, and then get them in memory care and skip the assisted living? Is there a transition time?
There is a transition time, however, only the loved one that's caring for that person can really determine, is it time for assisted living and is it time for memory care? People can come into your home and say, oh yes, I think they need to be, but really only you can make that determination if it's time. I believe that transitioning first into an assisted living and then memory care is always best for the loved one, just because it's getting them into the routine. And routine is vital when it comes to any kind of cognitive impairment, because if someone is just sitting in front of a TV, the rapidness of their brain declining is so much greater. It's actually 72% greater decline than someone who is socially engaged. So, and that's one of the things about being in an assisted living and memory care environment that is so vital, is because they do offer that continuing, not only care, but that continuing stimulation, both physical as well as mental.
So Melissa's going to be here a little bit longer as well too, to answer any questions. So if you guys have any specific questions for her about memory care, just make sure you get with her in the back as well. And then we're going to bring up Karen Amador, and she is going to speak on behalf of the continuing care retirement community. So, and I got us right back on track, man. Look at that. Come on, Karen. How are you?
Hi, I'm gonna stand.
Okay.
I'm so short that it looks like I'm sitting.
So Karen is actually the first person I met in town when I was what was it?
He was a baby.
I was back then. So we had just gotten our little facility, and I walked in. I was driving past the information center at Southport Square, and came in there. I had my basketball shorts on. I think I was remodeling our place. So I was headed to Lowe's, but I said, let me shop in there. And so anyways, Karen she was grateful enough to just give me all of this information. Hey, talk to this person, do this, do that. It really just helped just get me acclimated to Charlotte County and everyone here. So I'll forever be grateful for that. So thank you, Karen.
Well, and I have to tell you, from the moment I met him, you could see his passion. You knew that this was not just a job. This was not just something he was doing because he had to make money. He honestly cares with every ounce of his being about the people he serves and the people he works with. So I knew that from day one.
Appreciate you. So I don't know. I'm sure a lot of you guys are familiar with Southport Square. If you're not, it's a continuing care retirement community. And so, what does that mean? What is a CCRC? What does that actually mean?
Everybody hears the acronym CCRC. What CCRC literally stands for is Continuing Care Retirement Community. Now, the simple way is to tell you that means we have everything. We have independent living. You've heard about that today. We have assisted living. We have secured memory care. We have skilled nursing. We have our own home care division. So we literally have everything that you have heard about today. One-stop shopping, so to speak. The benefit of that, of course, is that you don't have to leave. If you come in as an independent resident, but that you start to need more assistance, you can stay in your apartment, have that service brought in, or if the day came where it was more beneficial for you to relocate to the memory care or the assisted or the skilled nursing, it's right on campus. So you're dealing with the same caregivers, you're dealing with the same staff. You don't have to deal with that physical and emotional transition of moving from one community to the other.
And that being said, I guess who I guess makes the ideal client though, for a CCRC community, and then I guess tied into that too, like as far as costs are concerned, to like help us walk through that process of all the different services you guys have.
Well, the ideal client is really anybody who wants to give up cooking and cleaning, have somebody wait on them hand and foot.
All of us.
All of us. By a show of hands, not any woman in here that says she loves cooking and cleaning anymore, she's lying to you. True? Right. as you have heard, one of the benefits of moving to these type of communities is you're giving up stress. You really are. And people who move to continuing care communities actually on the average live 8 years longer than people who stay home. And that's because there is no stress. Now, price is an easy question. It's not an easy answer. Price depends on 3 things. To move into an independent continuing care, they're not all the same. Some continuing care communities have an entry fee called Life Care, and Life Care is, for all intents and purposes, long-term care insurance. When you buy a Life Care contract, and about 95% of the people that live at Southport Square have a contract, but what that contract literally states is that no matter what happens to you, listen to this, no matter what happens to you ever, physically or financially, for the rest of your life, you can never be evicted. Now think about that. Because most of us did not plan to live to be 100 years old and spend $10,000 a month for nursing home care, right? We didn't. But that's what's happening. We are living longer and we're needing more care. So if you've already purchased a contract that gives you that peace of mind and security, that's one less thing on your plate. And I will tell you, as an adult child who supplemented nursing home bills for 7 years, it is the best gift you will ever give your children. No one ever has to say, who's going to take care of me when I cannot take care of myself? And who will pay for it if I outlive my assets? So that's Life Care. Now, price depends on the 3 things. The size of an apartment. We have 12 different apartment styles. We have studios, 1 bedroom, 1 bath, 1 bedroom, 2 baths, and 2 bedroom, 2 baths. Our smallest apartment is 600 square feet. Our largest is 1,600. That's a house. So size of an apartment, type of contract. I won't elaborate into all the contract issues. I'm more than happy to sit down with anybody. But we have variations on contracts. Some actually limit how much you will pay for the rest of your life if you need additional care by cutting the nursing home bill in half. Some give you a year of free assisted living, memory care, or skilled nursing. Then it also depends on refund options. So we have options that you can have money go back to the estate when you pass away, or no refund. Now, I personally can't understand why you want a refund, because guess what? You're dead.
Yeah.
Doesn't help you to pay more to get a refund, but there's people who like that option. So when you ask for a price, size of apartment, type of contract, and refund, I will tell you on a 1,000 square foot, that's a small 1 bedroom, your entry fee is going to be about $85,000. Now everybody says, oh my gosh, that's a lot of money. It is, but you have just bought something that says you can never be evicted. And we work with you. We know you need to sell your home. Typically that's an asset that you need to do. So we do a deposit, and then when you sell your home, you pay the balance. Your monthly fee on a 1 bedroom is going to be about $2,300 a month. And that, again, like most of the communities you've heard about, includes everything but your phone. So there is no stress. Light bulb burns out, we fix it. You have nothing to stress about. So cost is kind of one of those things that's going to be personal to your situation, because the same contract's not the best for every person, and that's where we come in.
Because I was just thinking too, I mean, someone might come to you after independent living. Like they may not need maybe independent living anymore, and maybe they're coming to you for assisted living. So that might be a different type of contract for.
If you to purchase a Life Care contract, you do have to start in independent living. However, if you have stayed home until you now need assisted living or memory care or skilled nursing, you can move directly into those levels of care and then just start. And that is just a month-to-month contract. It's not, you're not purchasing anything long-term.
Any of the insurances that we had talked about earlier, do they pay for a CCRC community?
Your long-term care policies are going to work the same for us as they do for the other assisted livings. It pays for the assistance, just like your aid and attendance does. Independent living is not going to benefit. However, if you have long-term care and you are independent and you start to need some assistance brought into that apartment, then that long-term care policy would pay for that assistance to be brought in, so you would not have to leave that apartment.
And are the contracts, I know the Life Care contracts are for life, right? But are there monthly options as well, or is there anything that, are there short-term contracts at all, or are they all long-term?
We do some leasing. We call it lease to Life Care, and what it is a way for a person to try it. let's say someone's never lived in Florida. They're not really sure they want to commit to something long-term. So we do a year's lease, and any time during that year they can convert, but we just don't do a lot of it because it's not our core product.
That's good. And then I guess what's the best way for someone to get started then, like with this process?
He's been there, he can tell you.
Gotcha.
The best way to get started is just schedule an appointment with me. I usually do it over lunch. It gives you a chance to share with me what your fears are, what your concerns are, and we all have them. They lied. We're getting older. It happens. So we all have those hesitations. We're all unsure of what's going to happen next. Sit down with me. If it's not something you're really going to move forward with, guess what? The worst thing that happened is you had a nice lunch. So that really is the best way. But I have some advice for everybody, whether you stay home, whether you move, no matter what it is. It's once a year, at a minimum, once a year. Review things. Review your long-term care policies. Review your life insurance. Review your health care. Review your wills. Because guess what? You may have all that set up, but you haven't checked it in a while. The person that you've left in charge passes away before you do. There's nothing there. There's no one to take care of it. So if you don't do anything but learn anything from this today, is take that home. You have to have some kind of plan. You do. A good friend of mine will tell you, if you don't have a plan, you are planning to fail. So start the conversation. You'd be amazed how many people, when I sit down with them, a couple, I'll say, have you talked to each other about what happens when one of you passes away? No, they haven't. Well, guess what? One of you will. We all will, but somebody's going first. And if you've not had that conversation, I will tell you, as being a widow, it's not the time to start because you're going through all those emotions. So you need to have that conversation prior.
Do you guys have any questions for Karen today?
What happened that year contract that you have with assisted living? You said it's not done too often, but when it does often, after 12 months and you run out of money, you have to leave.
Well, she is saying that if you're renting and you run out of money, you have to leave. In any community, yes, if you couldn't pay the bill, if you're just renting, you would have to leave. That's the benefit of purchasing a life care contract, because it doesn't matter. If you run out of money, you still stay there. And it is not Medicaid. We don't take your income from you. You actually would at that time then pay what you could afford to pay.
My question is, if you and your spouse moved into independent living and only one of you needed the extra assistance and the spouse needs more care, the person who still doesn't need care stays in the independent as the spouse moves on, or how does that work?
You actually would have a choice. If you're living with your spouse in independent living and one of you starts to decline and starts to need care, you will have a choice of having that person stay with you, bringing in the additional services, because we do provide those, or let's say it's an extreme. Someone's had a stroke. They need to live in skilled nursing. That's totally different. That person would go to skilled nursing. You would stay in independent living.
So you've made a commitment for your lifetime as well?
But everybody says, well, what if I'm not happy? Well, I will tell you, we've been there 32 years and I've worked there 12 years. You'll be happy. It's amazing. However, you can get refunds based on the length of time you've been there. If you live there a full 12 months and you want to move out, you're going to get 75% of your money back, and then it starts going down based on length of time.
85,000 entry fee, if it's you and your spouse, that's for each person.
No, that is a one-time. The second person would be 10,000, so it'd be 95,000 for two.
Guys, if you have any other questions for Karen, or for any questions you want to ask privately, feel free to ask her. I don't know how much time do you have today, okay. So she'll be here for a little bit while longer. So if you have any questions for her, please make sure you ask her, and I'm sure she'll be happy to help you guys. So
I'm only going to correct Chris on one thing, and I can because I'm old. These aren't facilities, none of them. They're private residential communities. They're your home. We want everyone to feel at home. All the communities that are here today, including Chris's, feels the same way. Everybody's a little bit different, and there's the right solution for everybody. Don't be afraid to ask questions.
And that's exactly why we have everyone here today, because a lot of us are all in the same industry, but everyone might have a different need or a different want that their family desires. So it's important for you guys to explore all those options. So, thank you. I appreciate it. I think we're bringing up Amanda next. Amanda, are you taking over with Miss Jessie? Is Willow here?
Willow is being taken care of in another room.
Oh. Jessie's got a sweet little girl with her today, so. All right.
Okay. How many people in the room have had the fortunate circumstance of after going through a surgery, they went into a skilled community for rehabilitation? Anybody in here? Okay, a few here and there. Your mom? Wonderful. Okay. So Jessie's community just up the street is Life Care of Punta Gorda. I'm going to let her tell you a little bit about the differences between a short-term and a long-term stay. But one of the questions that we wanted to start off with is, does insurance pay for your skilled nursing stay?
Well, first of all, I just want to say thank you for having me, Chris, and your team. I'm Jessie, the Business Development Director at Life Care Center of Punta Gorda. To start off with that question of insurance, whether it pays or not. For those of you in the room, you can follow me with what I'm saying. In skilled facilities, insurances pay for skilled services when you come from the hospital. So after a qualifying 3-night stay in the hospital, your Medicare will pay up to 20 days, 100%, as long as you are showing improvement with your daily skilled exercises. With that being said, when you convert to a long-term care stay in in a facility like mine, Medicare does not pay. And that's a misconception that a lot of people think, because I have Medicare A and B, I have coverage for long-term care, and you do not. Long-term care is an option for a lot of our aging population, but it is a private pay expense, or it would be covered by one of the Florida Medicaid programs. We can elaborate if you want, or we can go on.
Well, I was just to lead off of that, kind of tell us the differences between what a skilled nursing community with short-term versus long-term, and how is that different than an assisted living? Because we could go into licensures and all that.
Yeah. We can get really educational with this, because a lot of you may not even know what a skilled nursing facility is. So we'll start there. Skilled nursing facilities are medical facilities that provide professional services with nurses, physicians, and physical therapy, occupational therapy, and speech pathologists. We are the highest level of care in terms of nursing services. So if you are progressive, or if you are diagnosed progressive, or you have a disease that you are no longer able to stay in an assisted living environment, a lot of folks would call a skilled nursing community, because we offer that highest level of care. We have a 24-hour nursing protocol. We always have an RN in the building, and one of the services that Life Care Center of Punta Gorda provides that no other skilled nursing facilities have in Charlotte County is an on-site physician service. So I have an employed doctor on site at my community, or my facility, 7 days a week.
So that's as high as you can go. There are quite a few different licenses that some communities have. There's the standard license, the ECC license, the LNS license, and the Jessie's community, which is the highest that you can go. So what is the ideal person that would be in a skilled nursing community?
Are we talking about for rehab or long-term care?
Give us both.
Okay. So rehab, we see a lot of different things on the spectrum of compromised patients. We do a lot of hip and knees, orthopedic-wise. We see a lot of cardiac and stroke here in Charlotte County, as well as your basic UTIs, which is a urinary tract infection, to pneumonia. For long-term care, this could be any of the above listed that I just spoke about, or your advanced Alzheimer's. So to piggyback on what Melissa Vanderbilt Bester of the Springs had discussed with memory care, we have a 27-bed unit that is devoted to our female-only Alzheimer's patients. We're the only skilled facility, again, in Charlotte County that has a memory care option for females, and this is an elopement risk factor when diagnosed with Alzheimer's type dementia.
And is that something where Medicaid could kick in if they need that care with Medicaid?
Yes, and we could talk for days on Medicaid. So if anybody does want to talk a little bit after more in depth about Medicaid, I'd be happy to do that. I have cards in the back. Medicaid eligibility is not easy. It's very overwhelming, but I am someone who is very passionate about getting that because that is an entitlement program. You may think you're not eligible for Medicaid benefits, but you may be.
That's fantastic. Thank you, Jesse. And we started to kind of go over what is the difference between a skilled and like an assisted living? Or did you kind of talked about that with the nursing?
Yeah, with skilled nursing, we're 24/7. So we operate, we function, we have an RN, and like I said, the physician on-site service that we have 24 hours a day.
And does someone need a doctor's order to come into a long-term situation or even a short-term situation with you?
Yeah, so the forms that the folks talked about to be admitted into an assisted living, we have something similar, but it's not an 1823 form. It's called a 3008 form.
Just to throw in another one for you.
This is signed off by the physician who's either seeing you in the hospital for your whatever's going on with you in the hospital, or if I'm taking you from home, which a lot of people don't realize, you can be admitted to a skilled nursing facility from home too. We can talk about that if you want, but that 3008 form would have to be signed again by your doctor.
So that was my next question.
Okay.
If someone does feel that they're qualified for your services and want to take advantage of them, how do they get started?
Okay, so one of the great things about Medicare A is if you've been in a facility, doesn't have to be mine at Life Care Center of Punta Gorda, but if you've been in a skilled nursing facility within the last 30 days, you don't have to go back to the hospital to get that qualifying 3-night stay. You're eligible within those 30 days to readmit to a skilled nursing facility, and it doesn't have to be the one that you were previously at. It could be any, as long as you're in the state of Florida, because they are, once you cross borders, they are different per state. But another way is if you belong to an ACO, and I'm just gonna get real specific, I don't know who in the room is belonging to Millennium Physician Group, but if you are an ACO member with Medicare benefits, you can be directly admitted to my facility.
And what is ACO?
Accountable Care Organization. Anybody in the room know if they're an ACO member?
Yeah, what is it?
We get that question a lot. Typically, your doctor will know if you're part of the ACO. A lot of the patients don't know unless they've already been in a skilled facility, but you're identified based on your Medicare number.
How do you get qualified for the ACO program, or is that something that only your doctor can do?
Right now, the ACOs, and I'm speaking on totally, somebody else's behalf because it's not my jurisdiction, but one of the offerings that you get being part of the Millennium Physician Group is being able to have this service, this direct admission service by your primary care provider within the Millennium Group. But like I said, you're identified based on your Medicare number, and you would have to ask your primary care physician if you're an ACO member.
Millennium Physicians.
I was really just speaking on behalf of Millennium, yeah. Do you? You're not automatically. Nope, it changes every quarter, and you have to have Medicare. You can't have a Medicare Advantage plan. Medicare.
All right, let's open it up to the audience. What questions do we have out there? Now you're really quiet. Every time I come up, I think you get quieter.
You saved the best for last, folks. I'm ready.
This is just a quick follow-up. You said you can go back into the facility within 30 days without going back to the hospital. Does it have to be for the same medical problem?
Yes,
Okay.
that's a great question. So let's say an example, you fractured your hip. You were in a skilled nursing facility for 10 days. You go home, you spike a fever, you have a lot of pain coming from that left hip. You
don't have to go back to the hospital.
you don't have to go back to the hospital.
But if it starts hurting in your right arm, you do.
Yeah, exactly.
Yes, ma'am.
What would the difference be between a skilled nursing facility and a nursing home?
So, it's 2019. I'm here to tell you that there is no difference. All 7 of the facilities here in Charlotte County operate under the same guidelines. All of our beds, we have over 1,100 skilled nursing beds within 7 miles of each other. They are all duly certified. So every bed can be billed under Medicare and Medicaid. So the skilled nursing facility is technically temporary stay, and your nursing home lingo would be your long-term stay.
The difference is it's 2019 and things have really changed. Your perception of what a
Yes.
nursing home is very different today.
And if I can leave you all with anything, I would encourage you guys to take a tour of any one of the 7, all of the 7. You don't technically really plan for something terrible to happen and end up in the hospital unless you're scheduling an elective surgery with an orthopedic surgeon. And it's really not what a lot of you may think or what you may have read or seen in the movies. Things have really, really changed.
It's like living on a cruise ship now, isn't it? Any other questions for Jesse?
I am pretty familiar with the facility because I go to an Alzheimer's support group there. I don't know the reason why you only have women. Is there any plan for a men's memory care?
I'm gonna tell you just what we have locally. I know there are male opportunities up in the St. Pete area. But the reason a lot of the memory cares in skilled facilities, I can only speak for skilled nursing facilities, the males tend to become very aggressive. And on the other side of the spectrum, they tend to become more emotional than women do. So with that being said, yeah. I mean, that can really cause conflict and raise, eyebrows when a spouse or a loved one is coming in and, their significant other is, becoming, you guys can fill in the blanks there.
Any other questions? Oh, yeah, she was asking about the average stay. So a knee surgery, what's your average stay for an orthopedic surgery like that?
14 to 21 days, 2 to 3 weeks. But that's based on individual performance. It really is. Somebody who's very high level, very high functioning and active prior to a surgery can be out in 7 to 10.
And just to loop it back to the very first presenter that we had, you could go home from this skilled nursing facility with your short-term stay with the Medicare Home Health Agency.
Yes, you're not forced to stay, you're not locked behind doors. You are entitled to make your choice if you're choosing to go home prior to a recommendation of staying. Yes, absolutely.
And family can take them out to dinner and stuff too.
Oh yeah. Medicare will allow a brief LOA every day. Mm-hmm. And when you do sign somebody out of a skilled nursing, you're taking the liability. You're taking the risk as the person removing them from the facility that if anything happens, you're liable. A sign out sheet, yeah.
Any other questions? Okay, we do have bags for each of you as you're leaving. Make sure you gather those today. Everyone's contact information is included in those bags. And I know that Jessie would love to answer any additional questions if you have something that you would like to ask her privately. But let's give Jessie a round of applause. I'm going to bring Chris back up.
Thank you, Jesse. As always, thanks, guys. A big shout out to all of our speakers today too. So thank you guys for all your help today. I know there's a lot of information. it can be very overwhelming, but at least you have maybe a piece of a little bit of everything that might be available to you, and now you know where to find it. And of course, if you have any questions, you can always reach out to Amy and I. Did you guys find like this conference, for those that came to all three or a couple of them, was it valuable to you? Okay. So one of the things that we want to do is we want to bring this back again next year. We're going to do it in March 2020. We got a massive conference coming. We're going to have speakers that are actually flown in. So it's going to be a really exciting time. We're going to talk a lot about caring for the caregiver. We're going to have workshops. We got a lot of really cool stuff planned. It's going to be a 300 to 400 person event at the Charlotte Harbor Event and Conference Center. So I just want to share that with you guys. That's going to happen in March 2020. So just if you found value today, please just share this with others, so that when we come around to that time next year, we can make sure we can share this information, get the appropriate information to the right people. So thank you guys again for coming today. You have a great weekend, and we'll see y'all soon. I forgot, we got raffle baskets. Man. All right. How many do we have, Amy? We have 5? Oh man, we got all sorts of lucky winners here. All right. All right, guys, I don't know if you guys still have your tickets on you, but I'm gonna call, I guess we have 5 raffle baskets, so the first one's gonna be 157. 157. All right. So we got a winner chicken dinner over here. The gentleman in the hat. All right. That's right. All right, guys. We got another one. It's 172. 172. I like it. She's got a little stress ball with her, right? Is that what that is? Yeah. 172. All right. I got 2 more or 3 more, right, Amy? Okay. And we got 187. 187. And we have 187. All right. You got 187? Let's hear.
No, you're not yours.
That's all right. That's all right. What? Oh, you want? Okay, all right, cool. Yeah, all right. Woo! All right, we got 213. 213. All right. All right, this is the last one. What's the last one? Is it special? Is it more special?
They're all the same. They're all special.
That's because Amy made them. They're all. Did you make them all, Amy? Because she makes the best rap. She really makes the.
Cool, last number.
201. 201. Someone else?
Hey, if they're not here, you have a second chance because some people left.
201. 201. No. Oh yeah. Right. Oh man.
201.
Nope. Not 201. We'll do one more. All right. See, you guys got a second chance here. All right. Here we go. It's 214. 214. All right. That's awesome. All right, guys. Hey, thanks again, everybody, for coming out today. We appreciate you guys.
Trash can right there. Trash can.
Where's the bathroom?
You want to play some games?
There's a lot of complicated
My husband, Abel, Mike. Yeah, you either have to have money or not have money.
Let's talk about next week. You got me choked up. I was like, I choked up a lot today. Man. I was like, an emotional day, you know. But it's about helping out. That's what I wrote one thing today to set up time next week. And then I tried to okay, all right. Thank you. I appreciate it. No problem. Thank you.